On Wednesday, April 8, government received 29 ventilators from the European Union to support patients who need intensive care in hospitals and to treat those infected with the coronavirus COVID-19.
This represents for us a major advancement in the implementation of our COVID-19 response plan. This donation not only represents a significant part of the implementation of the plan that we have, but perhaps in terms of life-saving procedures, given that we do project that you will have a certain percentage of COVID-19 patients who will require assistance in breathing at the highest level of intensive care. This donation of about 1 million euros, 150 million Jamaican, represents the most significant in terms of saving lives. And as a consequence, I cannot overemphasize the thanks and the gratefulness on behalf of the government of Jamaica, the people of Jamaica, to the European Union for this contribution. It has effectively doubled our capacity in terms of ventilators in one major action.
There couldn't be a better time for this kind of support from the people of Europe to the people of Jamaica. As you know, there is an enormous demand for these machines worldwide. So we're very, very lucky to be able to get so many of them and bring them to Jamaica. We will also be, like all the other international partners, trying to see how we can find additional funds or move funds from our assistance to the country to provide even more money for whatever is going to be needed.
The ventilators are being distributed to hospitals across the island. Of the total, 6 are small mobile ventilators. On the same day, the Minister of Health and Wellness, Dr. Christopher Tufton, toured the National Health Fund to assess COVID-19 medical supplies.
We have a full warehouse here under heavy security, let me add that. And we have been able, despite the challenges of logistics and sourcing some of the vital equipment, we have been able to access critical supplies like ventilators, monitors, ICU beds, stretchers. We brought in 500 N95 masks, which are very important for usage. We have a number of our temperature scanners and other critical items. So I think we're in a position now where we can safely say for the next 2 to 3 months, in terms of some of the very critical items, we have a critical supplies in storage.
And the health minister met with and commended the 80 final year medical students from the University of the West Indies who recently joined the ministry's COVID-19 response team call center.